Hey everyone, it's Crystal here in the AAFE Training Center, and today I am treating one of my regulars with some neurotoxin. So you can see I'm starting with her frontalis, just kind of marking up exactly where I want to go. Her glabella is a perfect example of someone who's been getting neurotoxin for, I've been treating her for at least the last 3 years. So you could see when she kind of made her angry face, and I marked it out, it was kind of hard to see exactly where the tails of her corrugators were, which is pretty common in patients that regularly get neurotoxin. So just make sure you're really paying attention to that and not going too far out when you treat the corrugators, because if you go too far lateral, you're going to end up in the frontalis and then they're really going to have a dropped heavy brow. So you can see I'm starting with her frontalis dosing. Just going in and leaving some neurotoxin around each dot, always making sure I'm not going directly through my dot just for sterility reasons. So you can see I'm either going kind of like right next to the dot or below it or above it, whatever. And you can see because I couldn't really see exactly where the tail of her corrugator was, my injection is pretty superficial. So I'm not diving my needle deep whatsoever. Then moving over to the crow's feet, so treating her orbicularis oculi muscle, and she always gets lines kind of underneath the eye, almost like a jelly roll area. So you could see that I am treating all of these pretty superficial, always up and away from the eye. And then this jelly roll region is very, very superficial, directly underneath mid-pupillary line, never going more medial than that. Going in and leaving just a little bit of neurotoxin in each area. These tend to be pretty sensitive, pretty pinchy for patients, so I try to pull the skin kind of taut just so you can get the needle in there pretty good. And then you can see how superficial it really is. You can see the gray of the needle, and it's almost like a little wheel or a TB test. This is her lip flip. I unfortunately forgot to put any kind of numbing on her or give her ice, so this was very, very spicy for her, but I said it's kind of nice to see this because this is a real reaction to a lip flip. It doesn't really feel all that great. You can see I am treating more areas than I would for radial lip lines, and I'm keeping my injections pretty superficial. So you can see like just the bevel of my needle is going in, pulling the skin nice and taut so I can see exactly the depth I'm at, and leaving neurotoxin in all areas. And that is it. Thank you so much for watching, everyone, and we'll see you in the next one.